What's up, YouTube? This is James coming back at you with another informative video. Hope everybody's doing well out there this evening. Doing real good myself. I come across this story right here, and hey, it's all about that vaccine. Not to take it, okay? It says here, man suffering from massively swollen tongue after COVID treatment comes to Houston for help. All right, and it's nothing nice to look at. Just so you guys know, a little bit of warning. You understand? Says here though, Anthony Jones, who is from Florida, came to Houston for treatment after his tongue became swollen. He couldn't close his mouth. All right. Now I'm going to show you guys this video, and I'm telling you right now, it's not for the faint of heart. Who would even thought that anybody's tongue can come up looking like a pig bladder or something? Check this out.
A COVID-19 survivor has quite a story to tell, and he is telling it exclusively to KHOU 11 News. Anthony Jones was intubated in the hospital, and when he regained consciousness, his tongue was so swollen he couldn't close his mouth. So he came to Houston for treatment for this rare side effect. And we want to let you know some of the images are graphic. Stephanie Whitfield reports.
After the year he's had, Anthony Jones is grateful to have a smile on his face.
It wasn't here. It wasn't here a couple months ago.
Jones got COVID-19 in July. His wife says he spent 3 weeks in intensive care on a ventilator.
They was trying to heal his lungs. His lungs was messed up real bad. So they had to turn him on his stomach for 12 hours.
Doctors say being in the prone position, lying face down, helped his lungs, but caused extreme swelling in his tongue. He lived like this for 3 months.
They was like, I don't know what to do with it. Nobody knew what to do with the tongue.
But a specialist in Houston did. Dr. James Melville with UT Health had treated the incredibly rare condition called macroglossia before.
Actually, twice before. We wrote a publication on it, and that's how Anthony's mom found us.
Melville operated a few weeks ago. The before and after pictures say it all.
He's cured. His speech will get better and better. And I gave him cream brulee today, and he can taste every one of them. He's going out to Texas barbecue today.
He says the benefits of the prone position outweigh the risks for critical coronavirus patients, but it may lead to more cases of this rare side effect. And if that's true, this COVID survivor wants others to know there is hope.
I kept the faith, and things went the way they were supposed to go.
Stephanie Whitfield, KHOU 11 News.
Now that's scary. I never knew a person's tongue can swell up to the size of a damn catcher's mitt. You know, a pig bladder. I mean, something just is unnatural. This is a horror story. You see what I mean? And they gave him the vaccine, and that's what did it. And he, if you recall this guy, the newscaster said it was a rare side effect. How you know that it's rare when they just came out with this particular vaccine? Okay, let's read a little bit. As we already know what's happening. Well, let's just go through the article. Okay, Houston. This is something you have to see to believe. A man in Florida was critically ill with COVID-19 when he regained consciousness. His tongue was swollen. He couldn't close his mouth, and as we seen that, Anthony Jones of Lake City was hospitalized with COVID-19 in July. A day later, his wife Gail says he was placed on a ventilator, And for all you guys out there still talking about this is not real, this is a scam. Do y'all see that man's tongue? Now, like I said, it wasn't that the COVID-19 actually did this. It was the vaccine that they gave this man. Okay, that's the understanding that I get, But it goes on to say here, they were trying to heal his lungs, Gail said. His lungs were messed up really bad. They had to turn him on his stomach for 12 hours. Lying on his stomach helped his lungs, but caused extreme swelling in his tongue. Okay. Jones lived like that for 3 months. 3 agonizing months at that. Okay. It goes on to say, continue, before his mom found a specialist in Houston who know how to treat the rare condition. Extremely rare, said Dr. James Melville with UT Health. I think out of a literature search for his situation, we found one more case, so to out of the whole pandemic. But Dr. Melville with UT Health thinks there may be more since many COVID patients are placed in the prone position now. Okay. If that's true, Jones wants others to know there is hope. I'm just thankful I'm able to talk, said Anthony. Wow. So, in other words, these people are learning from trial and error. They turned him on his stomach, and that relieves the swelling, the fluid off his lungs. But shit, it went to his tongue. Look at this right here. Oh man, that's ugly. Who would have thought? Now, yeah, I can see you want to get a thumbs up and that you happy and everything, But yeah, I'm still, they're pretty much saying, I'm getting a better understanding as we go along. They're pretty much saying that the fact that they turned him on his stomach, it relieved the pressure off in the edema, which is fluid, off of his lungs, but it still made his tongue swell. I don't understand that. But far as I'm concerned, vaccine, cuz they had to give him that vaccine. I'm scared of that, But all praises to the Most High, he bring him through it. You know what I mean? Because going through life and your tongue looking like this, that can't be good. Y'all tell me what y'all think about this particular story right here. I'm interested in hearing your thoughts, views, and opinions on it. Like, comment, share, and subscribe. People, please remember to live your life as though we are being watched. Simply because we are. This is James, and I'm out. Peace.